Surgical assisting, prep to post-op, instruments used in surgery. We will focus on the types of instruments used in surgery and the proper care, cleaning, and packing of these instruments for sterilization. There are hundreds of different instruments used by veterinary surgeons. For the purpose of this program, however, we will narrow our discussion to the most commonly used instruments found in veterinary general surgery packs. Your familiarity with the instrument names and their purpose will be especially beneficial when assisting in surgery if it becomes necessary to hand the surgeon a particular instrument. Let's begin with the scalpel. This cutting instrument consists of a disposable blade and a reusable handle. Various blade sizes and shapes are available. Shown here are 3 of the most commonly used blades with their corresponding numbers. The attachment and removal of these blades should always be done with needle holders by lifting the back of the blade. Never use your fingers, as this may result in a serious injury. Other instruments used in place of a scalpel are the electrosurgical units and surgical lasers. Both of these units serve to not only cut the tissue, but they are quite effective at coagulating the blood at the site of the incision. Thus, incisions result in minimal bleeding. The use of these instruments will require you to familiarize yourself with the manufacturer's operating instructions. The needle holder's primary functions are to grasp the suture needle while suturing tissue and to aid in tying the suture knots. There are 2 general types of needle holders, the Mayo-Hagar and the Olsen-Hagar. Note that the Olsen-Hagar needle holders have scissors built in for cutting the suture ends once the knot has been tied. Another component of the needle holder is the ratcheted box lock feature in the handle that maintains the instrument in a closed position. To release the instrument's grip, squeeze the 2 handles together while offsetting the locking mechanism. Scissors come in various styles and shapes. Operating scissors are described by whether the blade is straight or curved. They are also described by their tips, either sharp or blunt. This pair of Metzenbaum scissors has a curved blade, and both cutting edges culminate with a blunt tip. They are used for cutting and separating delicate tissues. They should never be used for cutting suture or other tough materials like drape paper. The heavier Mayo scissors, shown here, are used on tougher tissues. Other scissors commonly used are Litauer suture removal scissors, wire suture cutting scissors, and Lister bandage scissors. Forceps are instruments used to grasp and hold tissues. The thumb tissue forceps is simple to use with its spring action design. This instrument should be held just like you hold a pencil. This brown Adson thumb forceps is equipped with additional teeth that allow it to stabilize the tissue without crushing. The Adson thumb forceps with its fine teeth is a popular choice for grasping delicate tissues. Other tissue forceps are designed to grasp and lock onto tissue. A common example of this is the Alice tissue forceps. The teeth of the Alice tissue forceps create a firm grasp of the tissue, but generally cause some tissue trauma. Hemostatic forceps are designed to squeeze off blood vessels and control bleeding. For small blood vessels, mosquito hemostats are used. For larger blood vessels, Kelly and Cryle forceps are commonly used. Note how the teeth of these Kelly forceps extend only halfway down the instrument, whereas the Cryle forceps have teeth that extend along the entire length of the gripping surface. Carmalt forceps have grooves that run parallel with the instrument. Rochester Carmalt forceps also have perpendicular grooves at the tip that crosshatch the longitudinal grooves. These grooves are designed to grip and crush. They are commonly used in space surgeries to crush the vessels that are being ligated. Towel forceps, as the name describes, have the purpose of grasping the towel or drape and securing it to the patient. Retractors are instruments designed to hold back tissues. The retractor, properly used, allows the surgeon to more readily visualize the tissues they are working with. Some retractors are meant to be held by the surgeon or assistant, like the malleable retractor shown here. Another variation of the retractor is the Snook avariohysterectomy hook. This instrument helps the veterinarian gain control of the uterus when performing an ovariohysterectomy or space surgery. The Army-Navy retractor is used to retract skin, fat, or muscle. Self-retaining retractors like this Balfour retractor allow for hands-free retraction of the abdominal wall during surgery. These instruments are some of the most commonly encountered instruments in the veterinary general surgery pack. You should familiarize yourself with the names and purposes of these and others that are used in your hospital. There are many other types of instruments used in surgery. Most veterinary hospitals will have a variety of surgery packs containing just the needed instruments for a particular type of surgery. When passing instruments, drapes, or suture material to a gloved surgeon, you must again apply aseptic technique. Never reach over the sterile field or drop items onto the instrument tray, as this can become a source of contamination. When passing instruments, peel the outer wrap back, being careful not to touch the contents or inner surface of the wrap. The instrument should be exposed and held very still for the surgeon to grasp. Once the surgery is complete and the sterile field is broken or no longer needs to be maintained, it is time to begin the cleanup process. Caring for these expensive surgical stainless steel instruments is a very important component in ensuring that the instruments last many years. Before blood has had time to dry on the instruments, they can be soaked in cold water to facilitate a thorough cleaning. Then they will need to be scrubbed with an instrument brush and an instrument cleaning detergent to be sure they are 100% free of obvious blood and tissue. Rinse the instruments with distilled water. Many hospitals will then utilize an ultrasonic cleaner to aid in removing small debris from areas of the instruments that are not easily accessible. Next, the instruments are allowed to soak in a solution called instrument milk for approximately 10 minutes. This non-oily lubricant provides the instruments with a protective barrier that helps prevent corrosion. This is especially important for those instruments with hinges or moving parts. There are also spray bottle forms of instrument lubricant available that some hospitals may use in place of the soak. The instruments are then allowed to air dry. If instrument milk is not used, they should be hand dried. The packing of the instruments will vary greatly based on the unique circumstances and preferences of the doctors in your practice. Instrument packs are often customized around a specific surgical need. For example, you might have general surgical packs, an orthopedic pack, an ophthalmic pack, and a laceration pack. These custom packs should be arranged the same way with the same instruments every time. The instruments are loosely wrapped in such a way that no sharp-pointed instrument will penetrate the wrap. Be sure all accessory items are included, for example, drapes, gauze sponges, a sterile indicator, suture needles, scalpel blades, and huck towels are sometimes included in the surgical pack. When packing instruments, be sure that box locks are open, bowls are on their sides, and small loose objects are secured. Finally, be sure the surgery pack is either double wrapped or wrapped in such a way that it can be opened without breaking its sterility. Before repacking the surgery pack, make sure that all instruments are accounted for. This is often done by having a checklist or illustration showing all the instruments in that particular surgery pack. Every instrument is important and should be accounted for. Once the pack is wrapped, it is taped with sterile indicator tape. The date of sterilization and the surgical assistant's initials should be clearly marked on the outside of the pack as well. The surgery pack is now ready to be sterilized in the autoclave. Your familiarity with surgical instruments will not only make you an asset to the veterinary surgeon as you assist in surgery and surgical preparations, but it will also make the job more interesting as you come to understand the way each instrument is used for its specific purpose. A basic understanding of suture materials will be helpful when assisting a veterinarian in surgery. Suture material is used for many purposes in surgery: closing wounds or skin incisions, strengthening joint spaces or weak tissue, and tying off blood vessels to achieve hemostasis. Suture material can be divided into absorbable and non-absorbable types. Absorbable sutures are designed to be absorbed by the body's normal mechanisms and completely disappear over time without the need for removal. Such materials are designed to be used within the body and will hold the tissues in place until they have had sufficient time to mend themselves and heal. Some common examples of absorbable suture are surgical gut, commonly called catgut, Vicryl or polyglactin 910, and PDS or polydioxanone. Non-absorbable suture remains strong and intact for extended periods of time, often years. Some examples of these are bronamide, nylon, proline, and stainless steel. They are generally used connecting tissues that require their extended longevity. Suture material can be categorized as either monofilament or braided, sometimes called multifilament. Monofilament suture materials tend to be strong and offer little tissue irritation. Because of the suture's memory or tendency to return to its original shape, the surgeon must be careful to ensure knot stability. Braided or multifilament suture materials are made up of numerous smaller strands. This offers better handling and knot security. This braided surface, however, can be a reservoir for bacteria. Look at the labels on the suture packs to determine which ones are the appropriate sutures the veterinarian has requested for the surgical procedure. Choosing the proper suture size and needle size is an important skill of the surgeon. The suture size is a measure of the diameter of the material. It is measured in a specific gauge ranging from 7/0 to a number 2 or 3 gauge, 7/0 being very small in diameter and number 3 gauge being quite large comparatively. The needle often comes pre-attached to the suture material. This type of suture is referred to as having a swedged-on needle. There are various sizes and shapes of suture needles that can be used, but they are generally divided into 2 types, cutting and taper. The cutting needle possesses razor-sharp edges that allow it to pass through tougher tissues, such as skin, with greater ease, causing less tissue trauma from the force that would otherwise be applied. The taper point needle has no cutting edges and thus passes through tissues without cutting. Swedged-on needles are discarded along with the unused portion of suture, whereas reusable needles must be replaced as they become dulled or bent from use. Special needle storage racks or gauze sponges are often used to contain free needles within the surgery pack. The suture materials are packed in either individual sterile foil wraps or in multi-use spools. The suture material on a spool will require the surgeon to first thread a needle before its use. The individual packs often contain a swedged-on needle. These swedged-on needles offer the advantage that they save valuable time and pass through the tissues with less resistance than a knot.